I hope everybody's doing great. Thank you for joining us in our last AI in Fedi this spring. Today, we're going to be doing AI in the clinical setting. We have some, like good news about AI in Fedi. We're being renewed for a season three. So, we'll be planning for some more sessions towards the beginning of the next fall semester. So we will probably be back around August and probably program for another seven sessions if that works. So thank you for that. And you can find all the sessions that we have done so far this year and the previous one in our AI in 30 page for the TLC. Today, we are going to be talking about AI in the clinical setting. Um, I'm going to briefly introduce some of the AI implementations that are happening in the clinical setting, but specifically about how they relate to teaching and learning. So there are other implementations and other applications of AI that you probably are seeing if you are in the clinical setting, but we are not going to address them because they go beyond our purview of teaching and learning. Some of them connect, so we'll see that in a little bit. Then I'm going to talk about, because these sessions with AI in 30 aim to be very practical, I'm going to talk about two use cases that come from specific needs. And we are going to be doing a little bit of a run through how can you start tomorrow using some of the AI tools that we've been talking about this season to hopefully do some things that you may have a need for in your setting. And then we're going to do briefly some implementation tips at the end. At any time, you can use the chat to let us know if you got any questions. My name is Federico Gomez. I'm an instructional consultant with the TLC. And if it's your first time with AI in SETI, thank you for joining. If you have joined before, welcome back. So about the some of the AI implementations that are happening in the clinical setting. You may be more familiar with them than with others, and some places are starting to connect those uses of AI with teaching and learning needs in that setting as well. So one of the things that, and I call them wish list items, by the way, because they are not implemented yet on every setting where you may be teaching as a clinical setting faculty, but there are different studies out there of how to use these tools to address some of the needs of the clinical setting. So one of them is matchmaking, which I found a curious concept because I don't teach in the clinical setting and I'm not in a clinical setting. It kind of like never occurred to me to think in these terms, but because sometimes trainees or residents don't get to be exposed to cases that are important in the rotation that they are because of the availability of cases or the knowledge of which case could be useful for some of the trainees that may still have that gap. There are systems now that try to match exposure to some cases based on the trainee experience, and they try to actually use the electronic hospital records to know which cases are in at any given time. So these may be more useful to you depending on the type of rotation and environment where you are. But this is definitely one thing that now with AI tools can be done. These uses that I'm presenting in this first part are not uses you can do on your own at any given time. The use cases are things that you can start working on, even if in your environment there hasn't been a full implementation of some of these tools. So think about finding opportunities for your trainees to actually be exposed to specific cases based on what's happening at any given time in the hospital or in your clinic, and how difficult that may be unless you have a full knowledge of what cases are out there and who is going to be where when. So this is a good use of tools that may have access to all that information in real time. Second item that it's a little bit more directed to how can we use AI tools to promote learning and to improve and support learning is this one. Many of you may be familiar with ambient scribes. They are happening in many places. We had a couple of um, sessions with faculty in the clinical setting these last months of past month of April, and where we were able to actually talk to clinicians, and they told us that yes, ambient scribes are being implemented where they are, and they are helpful for some things, but they also have some concerns about them, and we kind of like agree on those concerns. But one of the things that is happening and possible now is if the hospital starts connecting these elements and the department starts connecting these tools, having that documentation as a way for the AI to use it to first figure out if there are gaps on knowledge or skill or procedural skills on that trainee, and how to actually connect that with support, educational support. So these will require that the ambient scribe can be connected to the trainees system for feedback and start kind of like making matches between what's happening, what's being observed, and what kind of learning support it will require. So again, this is not something you can set up on your own because it needs to be set up on the back end. It needs to have a way for the AI to access trainee information and the scribe transcription and put this together through very specific prompting into how are we going to address these things and how are we going to get trainees what they need, and after interactions with patients through rotations, so they can actually in real time get some feedback automatically, but also get some support for the detected gaps there. So again, this is another item that it may be coming to a clinical environment near you, but still requires a lot of different decisions for implementation, and also it is above your level as an educator. So these needs to be a department decision with a hospital implementation. So it cannot be something we can do on our own. A third a third element that it's being used, a third use of AI is basically getting to use AI to support simulation. And this is happening in two different ways. One of them, we're going to talk about it today. We're going to see a use case for that, something you can do, you can start doing on your own. The other way requires a big investment in technology, right? Some departments, and depending on your area, are making this investment on virtual reality or augmented reality. These places use AI to actually generate simulations that can be very involved and can introduce challenges and can actually have a lot of more control into what the trainees experience. This is being used, for example, in surgical teams, because that allows for trainees to experience some situations way ahead of the real thing. And in your area, it may not be a thing. It may not be something that you really have the access to the technology, or there may not be a justification for using that kind of access yet. But the communication simulation, for example, it's something that it's much more achievable for us. So imagine being able to generate standardized patient for scenarios that may be difficult conversations or emotionally taxing. So this is achievable. This is doable, and some of our faculty are actually experimenting with this. The use case that I bring to you is inspired by a conversation I had with one of our clinical setting faculty. So it is interesting that we can start using these tools to create a safe environment where the trainees or the residents can experience and take a first step towards having these difficult conversations before those difficult conversation opportunities happen. So in this way, we can actually not depend on the availability of a case in which a conversation like this needs to happen for them to have the first approach to these. We can have a simulated conversation ahead of time that primes their connection to these conversations, gives them an opportunity to actually think through, gives them an opportunity to get some feedback as well, and an opportunity to do some reflection way ahead one of those conversations actually happening and them having to then step up to the conversation. So this is something we will see today through one of our use cases. The last one, the last item is, and this is a big picture kind of like use of AI. So imagine having AI connected to the ambient scribes and the information about the trainees, and kind of like getting a whole picture of where trainees are in their rotations and how are they performing in different skills, or how are they, showing different competencies. So if you have all these built into a system that uses AI to connect all these dots, you may be able to actually start having these kind of like look at where the trainees are, and having kind of like a dashboard that for a residency director gives them kind of like a view of where the trainees are, and also for the trainees gives them that view where they are, what are some gaps that need, like to be addressed, what kind of like reinforcement or support they need to actually go for, or what kind of things they need to pay more attention to. So in this sense, this is a kind of like a very big picture that will bring assessment into a much more comprehensive view. But again, as you can imagine, this is something that we cannot do on our own as faculty. This needs to be a decision of a department or even a hospital system or the university as a whole. So I wanted to bring you these quickly so you see that there is a big picture on the use of AI in the clinical setting, specifically for teaching and learning, but many of those things may still be sometime, like until they come to a clinical space near you. But that doesn't mean we cannot start using some of the tools that we've been introducing through AI in 30 to provide you with opportunities to start tomorrow, trying to bring some things you may need into your environment. And that's what we're going to move into next. Remember, if you have questions, please use the chat. We will try to keep the session to 30 minutes like we always do, but we will stay after the session. If you got more questions, we will stop the recording so we can, like bookend it for our sharing later on. But then we will stay. And if you got any more questions at that point, please stay, ask, and give us something to think about too. When it comes to use cases, today I bring you two separate cases based on specific needs. And that is probably the most important thing from our conversation today is you need to start thinking about how to use these tools based on the need, specifically in the clinical setting. The reason is because unlike the didactic setting where we take more time to plan and design for learning experiences, in the clinical setting, the need kind of like drives and the time constraints drive what you do and what you're able to do. For our first use, we're going to be looking into the need is what happens when we detect knowledge gaps, or we know that some of our trainees or residents may still be kind of like shaky in some foundational knowledge or some procedural knowledge that we may not have the time to address. And we have had traditionally different approaches to it. Like we may give them some specific readings on some reminders about things they need to be knowledgeable about, but we know that these gaps happen. And because you're in that setting, you're teaching and you see, residents come rotation after rotation, you already know ahead of time what are some of the usual suspects for these knowledge gaps or process gaps. So one of the uses that I bring for you today is using a tool that we've talked about different times. And I'm not going to do a show through, but if you need to know how to use Notebook LM, please check on our AI in 30. We have used it 2 or 3 times for different purposes. So there are ways for you to actually do that, or reach out to me and I will be able to direct you to resources on how to use it. But Google Notebook LM is a tool that allows for you to select a series of sources and keep the AI working and giving responses only on those sources. not only responses, but also it allows for you to generate a series of studio items, basically overviews, video overviews, audio overviews, summaries, and some other elements that may be useful for a quick look, quick reminder, but also the opportunity for your learners, your residents to engage with the tool, ask very specific questions that can be answered with the sources that you have selected. So this is a kind of like constrained AI model that allows for you to control what the interaction is going to be based on. And since you're an expert and you know which sources will be better, sometimes you already have these material because that's what you will recommend. But comes in the form of a series of articles or a couple of websites that contain the information. These will allow for a much more targeted intervention and support for your learners. How will you do that? So in Notebook LM, you have a basic dashboard that allows for you to see three different areas. The sources areas is where your expertise comes in. You are going to select sources that really are key for the content. And here I would like to emphasize, we want the fundamental sources. We don't want to give a huge variety of sources, not because it's not going to do a good job, but because it also is going to kind of like spread the answers to areas that you may not be interested in addressing. So these will be a targeted intervention, and creating these will allow for you to be very, very specific on those sources. So if you see the sources here, this is an example that comes from our dental hygiene department, and this is a specific need they were trying to address. So I'm going to shortly give you the need. Their residents have time in the clinic, and sometimes they get, a cancel appointment, and that gives them 15, 20 minutes kind of like break while that appointment that it's canceled is not happening. They would like for them to have an opportunity to review specific content that they've detected they have gaps in, and they would like to actually have that to be book-ended in the time that they have. So this is a proposal, this is a draft for them on how Notebook LM could work for them, where their sources that they already have, that they've selected for these, are combined with the potential for Notebook LM in that studio section, in that right section, to do different things that allow for these. So these will be kind of like something that could be used right away. It contains short video that it's 3 to 4 minutes long, kind of like gives a good overview of the topic. It also contains a little bit more deep dive as a podcast audio overview, and it also contains a kind of like summary of what the important key elements are. And it's time for them to require about 15 minutes to go. That can be done by calculating the reading time, the watching time, and the listening time. And it contains instructions for the trainees or the residents on how to use the notebook. Basically, it tells them, this is what you can find here. This is the time that it's estimated for these. And if you have specific questions that you would like to explore further, you can use the chat, and the chat will give you always answers based on the sources. So these will give them all the elements they need for that 15-minute interaction, but also the opportunity to explore it further if they want to use it for more time using the chat. So as you see, we are trying to address a very specific need. This is a knowledge gap that has been detected. This is something that the trainees or the residents may need extra support with. And what you got now is the opportunity to address it with a very specific notebook in this case. So as you can imagine, these can be done pretty fast, pretty quick once you know what you're doing, and once you know and specifically have like the need and your goals clear with these. But also is something that once you create one, you can start creating a library of these. And once you have different ones for different gaps, then you basically know how to direct trainees to what they need in the moment. Not all trainees may have the same knowledge gaps or the same process gaps. Sometimes you can create one thing because at the beginning of your rotation, you need to give a kind of like an overview of what they need to expect, or there is a process that it's a new thing that they're going to be exposed to, and you're going to create something like this to give them the opportunity to look into it ahead of the implementation or ahead of the experience. So there are different ways in which you could use this approach, but this is definitely a very solid tool that gives you a lot for your investment of time, and you can adjust based on the feedback of your trainees, how useful it is, how are they seeing that? Are you seeing that those gaps kind of like are not so visible as they used to be or so obvious that they used to be? So this is part of what you do as a faculty in this setting, and you can refine these through time. So you can actually iterate, create a new one, change the sources if you need to, because like content changes. We know more, or we know different, or we're implementing new processes. So these are things that will allow you to have a tool that is relatively low investment of time compared to the actual output that it can give you and the support that it can do for your residents. For a second use case, I am going to show you how can you use a different tool. In this case, you can use any large language model based tool like Copilot or Utiverse or Gemini, Claude, ChatGPT, any of them that allows for you to create a custom implementation or an agent will allow you to do these. And I've tested these with Copilot. That will be, one that we have in-house, that it's available to us through our Microsoft license. So you can actually get to try these or Utiverse today. The idea is what happens, and the need here comes from a couple of conversations with faculty in the clinical setting. Sometimes there are part of the experience in the clinical setting that has to do with those difficult conversations with patients. Trainees don't get to actually be ready for these conversations, and sometimes they just find them. They just find themselves in the conversation and may struggle, especially the first times, with those conversations. And what if we could actually preemptively give them an opportunity to experience a simulated version of those conversations, so they could start thinking about what are things they need to pay attention to, what are some things they need to think through before those conversations happen, what are things they would like to ask out of their the faculty before any of these conversations happens. So this is kind of like what will give you an entry into that. And the idea will be to create an agent, which is a customized interaction with one of these AI models that will simulate such a conversation. As you can imagine, that doesn't happen right away. You cannot just say, simulate me a conversation with a difficult patient. That's not enough information. The tool will actually ask you a bunch of questions if you did that. But there are workflows that can help you create those agents. As I told you before with NotebookLM, we have an episode on creating custom agents back in October last year by Dr. Caldways from the College of Pharmacy. So you can actually check that out on the how to actually create an agent. But this would be kind of like a workflow you could use for that. There will also be a toolkit that I will send you after this session through our follow-up email, and you will be able to actually also see the process step by step for this. But basically what you will be doing is first defining what the agent needs to be. Define the personality, the role, the behavior, what it will be the persona of the agent. You are basically telling the tool, I want you to be in character as this person. And you can define that person very well. You can define different dimensions of that. You can be like modulate the behavior, how difficult a patient you want to have, or how difficult a situation you want to have. It's defined when you are creating the agent. The second step will be to, and it's very connected to the patient as well, to the agent, is create the scenario. How are you going to be interacting with the learner is in this scenario. So that scenario can take many forms, and that scenario can be a patient, with untreated diabetes, or, you're talking to an expectant mother that it's showing some complications. And then we are going to need to address these specifically through this conversation. The third part of setting the agent is providing instructions, defining rules for how the agent should respond or should proceed through the conversation. These rules are the constraints. You don't want the agent to be going all over the place unless one of your objectives is what happens when the patient is kind of like giving us information we didn't ask for, and is kind of like going away, and it's not really answering the questions we need to have answered. How do we bring the patient back into, like getting us the information we need? Then you add conversation starters. Since learners are going to interact with these, once you share these in the end, the first thing that needs to happen is that they get introduced to this conversation. So you add conversation starters, which are prompts for the users to begin engaging with this conversation. The next thing that you will do is to test the agent. To you yourself get in and say, okay, I'm going to interact like one of my learners. I'm going to start these, and I'm going to kind of like go through this conversation and see what's here so I can refine and adjust the agent before I publish it and I share it. Many of these tools will allow you to test, to run these as a preview of how it will behave. And then finally, you will publish the agent, so make it available for others to interact with, and then share the agent with your learners, basically. When you publish it, you can give it certain constraints. You're publishing it for people in the same system or for people with the link. And then you share the agent with your learners with a link, and you explain to them, this is what this agent is doing. This is something I would like for you to give it a shot, see how it feels. And then you can connect these to a conversation at the end of the week or at the end of the rotation where you talk, or the next day where you talk about how did they experience that conversation, how realistic they think it is, what are some places where they felt they will have a challenge addressing these elements. And that priming that they've gone through becomes the big stepping stone for you to actually have those conversations, instead of have them in the abstract or have to have them after they experience it, but for the first time, without really being primed about what's coming to a conversation, to a interaction with a patient near them, in the early future. So as you see, these will be a use that you can start working towards tomorrow with conversations that are meaningful and important in your setting. So again, if you think something like these could work for you and you don't know where to start, reach out. We will work with you. We will, like brainstorm with you, figure out what tool will work better for you. And if you're trying and you're encountering some issues there, reach out and we will be able to actually work with you on figuring it out through. We don't have all the answers, but we definitely have, a lot of experience working with these tools as they are for the intended purposes of teaching and learning. So keep that in mind. A little bit about kind of like bringing all this to what to keep in mind while you're working in some of these use cases, if they work for you. Definitely first, aim to fit, to fit the need. Make sure that you are actually making something that addresses your need instead of thinking about big picture, or I'm going to do a general agent for all kind of conversations. That may not work for you. It may work for you to create one agent for each kind of conversation, and even for each difficulty level. You may want to scaffold those conversations and say, I'm going to have a general conversation with a patient that it's kind of like not being specific or avoiding some of the answers to the questions that we ask, versus I'm going to, a conversation where I need to address some important things about a diagnosis that we just found out, or like very difficult conversations to have with people that are in a tough spot at some point. So keep your need in mind when you're building these. The second one is always work with a clear idea of what your output should be, what you need to have at the end of the process of using one of these tools. And that is thinking about your learners and what they need and how you can support their needs that you've detected through your experience uh, during your time in the clinical setting. The third one will be always test the resulting interaction. Do not release any of these without actually checking out and see how the user will encounter them, and figure it out. If there's going to be some problems that you have in that interaction, then they are going to probably have similar problems. So address that before you share. Um, Consider privacy and safety. I think that this is a thing with any of every of our AI in SETI. So keep that in mind. Do not create any of these agents with personalized information or anything like that. And definitely refine and iterate, like refine and do a process in which you can refine these agents or the notebook LM, notebooks based on feedback. Once you get some feedback from your learners, use that to the next time that you revisit them. But also be creative. Like these use cases come from specific needs and from faculty trying to figure out how can they do the most in the setting that has the constraints and the challenges that the clinical setting has for teaching specifically. So be creative on how you use these tools, because some of them may have great uses that really, really fit that, like that need that you may have. Please give us some feedback. You will also receive an email from us asking for your feedback and following up and sending you that toolkit so you can actually revisit some of these elements and explore further. There's also a couple of challenges that I will always throw there for you to give it a shot. And please keep us in mind for season 3. We will focus a little bit more on workflows than in tools specifically. And that's something that's happening also, in the world. It's like there's so many tools right now that we will never end just addressing this tool, that tool, that tool. We're going to keep moving towards how do we use AI tools to, meet our needs. And that is through creating some workflows in how to use these tools for the things that we need as teachers and educators. So keep that in mind and also visit all the other events in the series. So thank you for your time today. Thank you so much and have a great day.